Dr. Jalali Hansal, cardiologist, National Guard Hospital. Constrictive cardiomyopathy versus restrictive cardiomyopathy, echocardiography. Dr. Jalali Hansal, cardiologist, National Guard Hospital. Outline background physiology, clinical features, echocardiography. M mode, 2D, Doppler, tissue Doppler, strain imaging. Conclusion. Etiology CP. Bertog SC, J.M. Cole Cardiol, 2004 43 8, 1445, symptoms. Darja KJ circulation, 1999 113, 1380. Varieties of constrictive pericarditis. Riamala et al. J. Thorac Imaging 1993. J.M. Cole Cardiol 2004 43 1445-52. Anatomy. Lieutenant atrium is not completely intrapericardial. All other cardiac chambers are completely intrapericardial. Pulmonary veins are completely intrathoracic. Effective inspiration, normal pericardium, constrictive pericarditis. Intrathoracic pressure. Venous return. Transient size of RV. Normal LV filling. Intrathoracic pressure. Venous return. RV not expanded. Abnormal LV filling. Up-to-date 2011. Mechanism. Filling impairment. LV-RV interdependence. Physiology CP versus ASM, constrictive pericarditis, restrictive. Myocardial compliance is NL. Pericardium not compliant. Septum compliant. Rapid early diastolic filling. Cardiac volume is fixed by the pericardium. Respiratory effect of LV on the RV. ABNL myocardial compliance. Pericardium compliant. Septum not compliant. Impedance to filling increases throughout the diastole. No respiratory effect of RV and the LV. Restrictive cardiomyopathy, myocardial disorders. Endomyocardial disease. Myocardial disease. Storage disease. Endomyocardial fibrosis. Hemochromatosis. Infiltrative. Non-infiltrative. Amyloidosis. Sarcoidosis. Idiopathic SMP. Diabetic SMP. E. William Hancock, Heart 2001, 86 343-349. Why is it important to make the distinction ASM versus CP? Associated with significant morbidity and mortality. Restriction rarely treatable/curable. Constriction may be curable with surgery. ASM findings CP in explained CHF. X-ray, no cardiomegaly, clinically, X-ray, BNP. Echo, normal LV systolic function. Findings. Transmitral Doppler. Restrictive pattern, E/A greater than 2. DDI. E 8 cm per second, E/E less than 15 normal S-wave. DDI. E less than 8 cm per second, E/E greater than 15. ASM. CP. CP. Choyanshaft. Hartfell Rev 2012. X-ray, no cardiomegaly, clinically, X-ray, BNP. In explained CHF. X-ray, no cardiomegaly, clinically, X-ray, BNP. Echo, M mode, 2D. Normal LV systolic function. Findings. M mode and 2D CP, pericardial thickening and calcification. Septal bounce. Dilated not collapsing inferior vena cava. Flattening of LV post wall. Early pathological outward and inward movement of the IVS. Color M mode propagation, 18% of PC head normal thickness. CP. Differential DX. Constrictive pericarditis. Pericardial tamponade. Pulmonary hypertension. LBBB. Right ventricular pacing. Paradoxal motion of the IVS occurring in early diastole. Sensibility 62%, specificity 93%. Journal of Thoracic Imaging. 27-1, W1, January 2012. Masturi et al. Expert Reverend Cardiovasc 2010. M-Mode CP. Signs reflecting increased ventricular interdependence. Abrupt early diastolic anterior motion of the IVS followed by a rebound toward the LV post wall. Masturi et al. Expert Reverend Cardiovasc 2010. M-Mode CP signs reflecting rapid early ventricular diastolic filling. Flattening at the LV post wall. Sensitivity 92%, specificity 100%. Vocal et al. Circulation. 1978 November, 58-5, 871-5. Masturi et al. Expert Reverend Cardiovasc 2010. M-Mode CP. Signs reflecting increased right ventral diastolic pressure above pulmonary arch pressure. Premature opening of the pulmonary valve. Sensibility 14%, specificity 100%. Masturi et al. Expert Reverend Cardiovasc 2010. Sensibility 74%, specificity 91%. MJ 2001,87,86-94. ASM 2D small LV cavity with large atria. Increased wall thickness, especially in interatrial septum in amyloidosis. Thickened valves and granular sparkling texture, amyloidosis. X-ray, no cardiomegaly, clinically, X-ray, BNP. Unexplained CHF. X-ray, no cardiomegaly, clinically, X-ray, BNP. Echo, M-Mode, 2D. Normal LV systolic function. Echo Doppler. Restrictive pattern, E/A greater than 2, DT less than 150 ms, IVRT less than 60 ms. Avenue inflow. Findings. Echo Doppler mitral and tricuspid inflow IVRT-TR hepatic veins. Pulmonary regurgitation. Pulmonary veins. Superior vena cava. CP specificity 67%, sensibility 86%. Jack, 1994 Jan, 23-1, 154-62. J.M. Cole Cardio 1994 Jan. 23, 154. Jack, 1994 Jan, 23-1, 154-62. Constriction, non-respirophasic. Mixed restriction and constriction. Marked increase in preload. Provocation test with head up tilting or sitting position with decrease of the preload may unmask the CP. Maish, Sefrovic, Ristich et al. Escape Guidelines on Pericardial Disease, EJ 2004. AF and CP. AF and CP. J.M. Cole Cardio 2001 37 to 1936 42. CP. Jack 1994 Jan, 23 1, 154 to 62. Diagrammatic representation of the transmitral early, E wave, and late, A wave, velocities during diastole throughout the respiratory cycle. Diagrammatic representation of the transmitral early, E wave, and late, A wave, velocities during diastole throughout the respiratory cycle. Note the dynamic differences between restrictive cardiomyopathy and constrictive pericarditis during inspiration and expiration. In constrictive pericarditis, the transmitral velocities are reduced while the tricuspid velocities are increased in deep inspiration, while the opposite happens during expiration. In restrictive cardiomyopathy, there is little respiratory variation. Nahianopoulos P. Dawson DOJ Echocardiography 2009 10:323-333. Published on behalf of the European Society of Cardiology. All rights reserved. Copyright the author 2009. For permissions please email journals.permissions@oxfordjournals.org, cp. CP. Circulation 2002, Rajagopalan et al. AJC 2001. CP. Normal. Specificity 79%. Sensitivity 86%. Circulation 2002, Rajagopalan et al. AJC 2001. CP. PV is not respirophasic. Normal. CP. Asthma. PV is respirophasic. PV is not respirophasic. CP. CP versus COPD. CP. X-ray, no cardiomegaly, clinically, X-ray, BNP. Unexplained CHF. X-ray, no cardiomegaly, clinically, X-ray, BNP. Echo, normal LV systolic function. Echo Doppler. Restrictive pattern, E/A greater than 2, DT less than 150 ms, IVRT less than 60 ms. Avenue and flow. Findings. Tissue Doppler. Annular TDI. Specificity 89%, sensibility 100%. Rajagopalan et al. M.J. Cardio 2001. E/E apostrophe equals 6. MJ Cardiol 2004 93 to 886 to 890. Mitral annulus reversus. Normal. E lateral greater than E septal. CP. E lateral less than E septal. Asthma. E lateral equals E septal. Rousset al. J. Echocardiography 2009. X-ray, no cardiomegaly, clinically, X-ray, BNP. Unexplained CHF. X-ray, no cardiomegaly, clinically, X-ray, BNP. Echo, normal LV systolic function. Echo Doppler. Restrictive pattern, E/A greater than 2, DT less than 150 ms, IVRT less than 60 ms. Avenue and flow. Tissue Doppler. Annular TDI. Findings. Strain imaging. Myocardial mechanics in asthma and CP. Deformation parameter. CP. Asthma. Longitudinal strain. Normal. Decreased. Circumferential strain. Decreased. Normal. JACC cardiovascular imaging. 2008 Jan. 11, 29 to 38. J. AMSOC Echocardiography 2009 hours 22 minutes 24 seconds minus 33. CP. Asthma. J. AMSOC Echocardiography 2009 hours 22 minutes 24 seconds minus 33. 2D speckle tracking. CP Asthma. Longitudinal early diastolic lengthening velocity. J. AMSOC Echocardiography 2009 hours 22 minutes 24 seconds minus 33. Too much for diastology. Conclusions. DX has important therapeutic implications. Clinical present and similar. Echocardiography, Doppler, DDI, strain/strain rate, have increased yield. Cardiac catheterization still considered mandatory, and X-ray, no cardiomegaly, clinically, X-ray, BNP. Unexplained CHF. X-ray, no cardiomegaly, clinically, X-ray, BNP. Echo, normal LV systolic function. Echo Doppler. Restrictive pattern, E/A greater than 2, DT less than 150 ms, IVRT less than 60 ms. Avenue and flow. Tissue Doppler. Annular TDI. Hemodynamic. Strain. International J of Cardio 137 2009 22-39. QTDI. Normal. CP. International J of Cardio 137 2009 22-39. International J of Cardio 137 2009 22-39. ASM. International J of Cardio 137 2009 22-39.